Eyelid surgery is still probably the most popular and frequently performed facial cosmetic procedure annually because the eyelids age a little quicker than the rest of the face. So our eyelid is a very delicate structure. The skin is very, very thin. It's the thinnest skin on the face. And it's a very dynamic structure, which means we're blinking and squeezing and rubbing our eyes. We do a lot of things that create wrinkles and redundancy of the skin of the eyelids. So you often will start to see some loose skin in the upper lid or wrinkles around the eyes, even in the 30s and 40s. And when it gets heavy enough, then surgical rejuvenation can be helpful. It has changed like everything else in our field with technology, new techniques, better understanding of anatomy. It is less invasive than it used to be. For the most part, upper eyelid surgery often entails removal of extra skin, and sometimes we will take out a little bit of fat to contour the lid to make the shape a little better. But we don't want to take out too much fat because we don't want your eyes looking hollow or gaunt, and we've all seen that look on patients who've had too much surgery or over-aggressive surgery, and that's to be avoided. In the lower lid, we often will leave the fat because we want, again, keep that full youthful look and augment it by placing more fat over it to blend in. So the dark circles and hollowness under our eyes are a result of aging and fat loss. When you replace that fat, the tissue under the eyes is less visible. So bags, sometimes a little bit of fat needs to be removed to take out really excessive bags. But more often nowadays, we actually use fat or fillers to fill in the hollowness around the eye, over the cheekbone, the dark circle. And that lifts the cheek and fills in the hollow and really gives a much better rejuvenation of the lower eyelid cheek area than actually taking out fat or taking out skin. And then the wrinkles around the eye, sometimes those can be treated with Botox, sometimes they can be treated with chemical peels or laser peels, and sometimes we will tighten the skin a little bit. And that's very individualized based on the patient. But sometimes we can just remove skin from the upper lid, reposition the fat, or layer in additional fat in the lower lid to add volume, and then that's it. And that makes the procedure much simpler, less downtime, quicker recovery.